Hello, I'm Kevin Gibbons. I'm the Executive Director of UBMD Physicians Group and the Senior Associate Dean for Clinical Affairs at the Jacobs School of Medicine and Biomedical Sciences here in Buffalo, New York. I'd like to take this opportunity to give you another update on the status of COVID-19 in our country and in our community. I've given a number of these over the course of the last year or more. I'm going to screen share with you now. This is the late December update, and I've given over a dozen, as I mentioned. I invite you to check them out on YouTube. We've covered a great many topics, including virology and evolution, mutants and variants, immunology, vaccines, the risk of vaccines, and most importantly, where we are in our community. This time, it's all about Omicron, really. I'm going to go over how we moved from Delta to Omicron. I'm going to talk a little bit about the science of Omicron. I'll spend a little bit of time on vaccine effectiveness, and again, where we are right now and what we can really expect for the next 4 to 6 weeks. So this is from the September update. I spoke to them about the upcoming waves in Western New York. The Delta variant has been just killing us since July 1st. I mentioned that in June, Kaleida Health System had one adult patient in hospital with COVID. In August, we were up to 30 to 40 per day. I mentioned the things that had caused the spikes last winter: return to school, weather changes, the holidays. And I spoke back then about the fact that we were going to see additional variants, and sometime we're going to see another virus. And here are the updates in the hospital numbers. In November, Kaleida census in the middle of the month was 67 COVID patients. Middle of December, 156. So clearly heading in the wrong direction at that point. I spoke previously, and this was from May, about what a variant of concern is. Basically, it's a virus that's either more lethal or more contagious, or one that has loss of what we call cross-variant immune protection or immune escape. And I pointed out in this graph that a more lethal virus is not necessarily as bad a problem as a more contagious virus that affects many more people. A more contagious virus actually kills more people, even if it's less lethal on a case-by-case basis. And that's an important thing when we start thinking about Omicron. So Omicron emerged out of South Africa with this massive spike seen in the upper right-hand corner here. In South Africa, when you look at their variant map, they had the original strains of the virus, if you will. Then they had Beta, which is actually a very serious variant of concern that's more lethal than any of the other variants we've seen. Then happily, in a way, Delta took over. And here's this blue area. This is Omicron, showing it went from 0 cases to over 75% of cases in a 2-week period of time. South Africa is sort of a unique situation. 25% of their citizens are vaccinated. They're typically the elderly. Over 75% of their citizens have previously been infected. And it's also the leader in HIV in the world, with 20% of their citizens suffering from HIV, and only half of them are under treatment. One of my presentations went over R numbers at great length. The R number, the R naught for Omicron, is probably over 10. So very briefly as to the science, one of the good news things about Omicron is it ends up with cold-like symptoms far more than lethal pneumonia. And this is a bit of science that says that Omicron replicates 70 times faster in the upper airways and 10 times slower in the lungs. More cold symptoms, less serious pneumonia. So throughout this epidemic, what happens in the United Kingdom typically precedes what happens in the US by a month or two. And certainly Omicron went very quickly from South Africa to the United Kingdom and very quickly became the dominant virus in the United Kingdom. Initially, they saw a steep rise in hospitalizations, but the good news is hospitalizations have been somewhat flat. That's good news given what we fear with this virus. Well, it made its way to the US quicker than it has in the past. As of the middle of this week, there's only 2 states in the country where Omicron has not been detected. And in the New York City area here on the upper left, you can see on this variant map, Omicron in purple went from less than 5% of the cases to over 90% of the cases. And this week, we had the first reported death out of Houston from the Omicron variant in a man in his 50s who was not vaccinated. And New York, 4 or 5 days in a row of record cases of COVID-19. And now In Buffalo, New York, in Western New York, the first case of Omicron was identified this week as well. So this is a slide from early December, from December 1st. And everyone was worried about Omicron, but I mentioned Delta is here and it's killing us. At that time, it was 80,000 cases a day and 800 deaths a day in the United States. The next week in December, it was 130,000 cases a day and 1,300 deaths a day. And that's what's been filling our hospitals in Western New York. And again, it's completely preventable with vaccination and boosters. As I said, on December 1st, Omicron is coming. It is as predicted. It may be different. It may escape vaccines or previous infection acquired immunity. And I said we would know in 2 to 4 weeks. Well, we now have a month experience. This is out of South Africa, but these numbers have also been replicated in the United Kingdom. Hospital admissions per 1,000 infections is a way to look at the seriousness of infection. So the original strains, it was essentially 44. That means 4%. Beta, I mentioned, is much more serious. 13% of those patients required hospital admission. Delta, 101, that's 10%. And the good news is with Omicron, it's under 4% require hospitalization. So that's a good number. That doesn't mean it's not a serious virus, but it's definitely causing fewer hospitalizations than with the previous versions of this virus that we've seen. It is interesting that lower hospitalization rate holds for adults, but actually children have a higher hospital admission rate with Omicron infection than they have with any other version of this virus. We've also learned about mRNA vaccine effectiveness. These are the most effective vaccines we have. Regretfully, 2 shots of the Pfizer, its ability to prevent infection went from 80% down to 33% in this study from South Africa. The good news is 2 shots of Pfizer still provides significant, although imperfect, protection against hospitalization. So vaccines in Omicron, you have to realize there's a range from no immunity, which is no vaccination, to remote infection. If you were infected a year ago and you think you have immunity, clearly you're wrong. That is not the case. The best situation is at least 3 shots of an mRNA vaccine. And if you have previous infection and you get an mRNA vaccine, you have what is often considered to be, quote, super immunity. Right now, our present vaccination policy is that you should get an mRNA booster when you're more than 6 months out from your 2 shots of an mRNA vaccine. And if you were given a single shot, the adenoviral vaccines, the Johnson & Johnson, you should get a booster 2 months after that single shot. Well, that's going to change. The future is definitely for earlier boosts. This week, it was announced in Israel that they plan to give a 4th shot now to all individuals over age 60 and all healthcare workers. So this is a booster on a booster. And the reason for this is because high enough levels of antibodies from these boosters do prevent infections. If your antibody levels are low, you can still get infected, but generally not a serious infection that requires hospitalization or results in death. So where are we right now? Well, here we are in New York as of 12/19. The case numbers are going through the roof, but that is somewhat artificial because so many more people are getting tested because of the panic over Omicron and the upcoming holidays. But the numbers with the uptick in deaths and hospitalization, those are real numbers. And you can see in New York State where our case numbers are absolutely spiking. Here we are in Erie County as of 12/19. We were ticking along through the fall as we normally do. Just like last year at the beginning of November, our cases started to rise. Here at Thanksgiving, we all got together, or some of us got together. There was a decrease in cases, but that's mostly due to a decrease in testing. But we really peaked on December 6th in terms of our 7-day average of cases, and things started to go down. That's good news. Regretfully, hospitalizations and deaths still remain an issue up to the point of the middle of December when this slide was generated. So where are we now? Well, we are past the Thanksgiving peak, but we still have, not enough people vaccinated in our community. Our hospitals were full, but I can tell you in the last week, they're better. Our ICUs were full, but I can tell you in the last week, they're better. But people have to understand how this occurred. One of our hospitals has an ICU with 20 beds. 15 of them were filled with COVID patients on ventilators. Well, over the course of a day or so, 6 of those patients died. So we were down to 9 patients. Well, it's good we're down to 9 patients, but those are 6 patients who died from a preventable disease. So this is where the great disconnect is. Earlier this month, there was an article in the Atlantic from an individual who lived in southern Michigan, basically saying, where I live, no one cares about COVID. It's a media or East or West Coast concern that people are going about their lives. It's not a problem. At the same time, the hospitals in Michigan were drowning, where they do not have enough room to take care of patients. Crisis standards of care were enacted. That means triage and rationing. So if you have a medical condition that normally would require transfer to another hospital for a higher level of care, and it used to occur in 4 to 6 hours, it could sometimes take 3 or 4 days to get a patient to where they needed to be taken care of. And by the way, when you got there, the person who is ideal to take care of your problem may not be there because they could be out sick. It's important to note that this year, the CDC noted that life expectancy in the US declined, the greatest decline since World War II. Closer to home in Syracuse, there's a report in the news of a mother and adult son who died minutes apart from COVID-19, both strong anti-vaxxers. I, over 20 years, ran an ICU, and I've signed plenty of death certificates. And when you figure out the cause of death from this preventable condition, what do you say? Misinformation, procrastination, stubbornness, politics. It's an absolute shame. And certainly, the patients who die and their families are victims of this disease. It's also important to note that our healthcare workers, especially our nurses, aides, and therapists who spend all their time with these patients, they're victims too. And they sometimes have a minute to cry, and then they have to move on to the next patient and take care of them. And they go home and come back the next day to do it all over again. But increasingly, these individuals are not coming back because they're leaving the healthcare profession when we need them most. So what does the future look like? Well, in the short term, we are clearly going to have rapid illness among non-vaccinated with some hospitalization and death. And the question is, how many and how quickly does this occur? We're going to have breakthrough infections among those remotely vaccinated or infected. And again, how many and how quickly does this occur? Is this going to limit our healthcare workforce and their ability to take care of people? 4% of patients with Omicron require hospitalization. Well, 4% of 300 plus million people is 12 million people. We don't have enough hospital beds to take care of them in January. So if this hits us so quickly and results in that kind of hospitalization, we're going to be in trouble. On the optimistic side, this may get us to population or herd immunity quicker than we thought possible. In 2 to 3 months, there will likely be a variant-specific booster coming out for Omicron. We have better therapeutics. Paxlovid, an oral treatment, just approved this week for under an emergency use authorization. We need new monoclonals. Regretfully, 2 of our 3 current monoclonal treatments do not work for patients with Omicron infections. And we have to realize we have to start looking for the next variant. And again, we have to worry about the next pandemic. This is the 3rd coronavirus epidemic to hit the world in the last 20 years. It will not be the last. And finally, thank you very much. Stay safe and be smart. In our house, when I say something stupid or do something dumb, people, my family say, gee, doesn't take a brain surgeon. Well, when you look at these numbers and you realize that the difference in death from infection between vaccinated and non-vaccinated is 13-fold, it's pretty clear what you need to do to stay safe and be smart. Get vaccinated, get boosted. Please have a great holiday. Thank you very much.